Have you ever wondered why we cough? Coughing, in fact, is the most common symptom that prompts individuals to seek medical attention. The human body is an intricate machine, and a cough is its way of responding to certain triggers. These triggers can be mechanical or chemical, stimulating nerve receptors within our bronchial tree, the network of air passages in our lungs. But what makes a cough effective? There are a few key components to consider. An intact reflex arc, which is a neural pathway that controls a reflex action, plays a crucial role. Additionally, the strength of our expiratory and chest wall muscles, along with normal mucociliary production and clearance, is also essential. Mucociliary clearance is our body's natural way of removing mucus and other particles from our lungs. So, understanding the cause and type of your cough can guide you towards the correct treatment. As you know, there are different types of coughs. That's right, not all coughs are created equal. They can be categorized into acute, persistent, and chronic cough illness syndromes. Firstly, let's look at acute cough. This type of cough typically lasts less than 3 weeks. Most acute cough syndromes in healthy adults are due to viral respiratory tract infections. You might also experience additional symptoms like fever, nasal congestion, and a sore throat. If you're experiencing shortness of breath, it may reflect a more serious condition, and you should seek further evaluation. In fact, a loss of smell or taste accompanying a new cough illness could be a symptom of COVID-19. Next, we have persistent cough, which lasts between 3 to 8 weeks. This type of cough often follows an infection and is sometimes referred to as a subacute cough. Pertussis, also known as whooping cough, should be considered in adults with a persistent or severe cough lasting more than 3 weeks, especially if they haven't been adequately boosted with the Tdap vaccine. Lastly, we have chronic cough. This type of cough lasts more than 8 weeks and can be a symptom of more serious conditions. When common causes like acute respiratory tract infections and chest abnormalities are ruled out, most cases of persistent and chronic cough are related to postnasal drip, cough variant asthma, or GERD. In some cases, coughs can be caused by less common factors. For instance, heart failure or hay fever can lead to an acute cough. Certain occupational risk factors, like being a farm worker, can also trigger a cough. Remember, breathing is not commonly affected in patients with a persistent cough. However, if you experience shortness of breath, it's crucial to seek medical attention, as this could indicate chronic lung disease, heart failure, or other serious conditions. Understanding the type and cause of your cough can lead to a more efficient treatment. So, if you've been coughing for a while, it may be time to visit your healthcare provider to identify the cause and discuss treatment options. What happens when a cough doesn't go away? Persistent coughs lasting 3 to 8 weeks or chronic coughs stretching beyond 8 weeks aren't just an inconvenience, they're an indicator that your body is grappling with something more severe. For instance, pertussis, also known as whooping cough, is a possible cause in adolescents and adults with an incessant cough. Notably, medications such as ACE inhibitors and conditions like acute respiratory tract infections and irregularities seen in chest radiographs can contribute to a persistent or chronic cough. However, the most common culprits are postnasal drip, cough variant asthma, or gastroesophageal reflux disease, otherwise known as GERD. There are also causes like non-asthmatic eosinophilic bronchitis, which accounts for about 10% of occurrences. Adding to these, there are more critical conditions to consider. Bronchogenic carcinoma, for instance, is suspected when a cough is accompanied by unexplained weight loss, hemoptysis, and fevers with night sweats, especially in individuals with significant history of tobacco use or occupational exposures to substances like asbestos, radon, diesel exhaust, and metals. Persistent and chronic coughs, particularly when accompanied by excessive phlegm, may signal the presence of chronic obstructive pulmonary disease, COPD, especially in those with a history of cigarette smoking or a case of bronchiectasis alongside a history of recurrent or complicated pneumonia. Chest X-rays, CXR, are instrumental in diagnosing this condition. Sjogren's syndrome, on the other hand, is often represented by a chronic cough coupled with dry eyes. Lastly, a chronic dry cough could also be the first symptom of idiopathic pulmonary fibrosis. No matter the cause, a persistent or chronic cough warrants medical attention. Remember, your health is in your hands. Let's go further into the serious health conditions that can lead to a continuous or chronic cough. One such condition is bronchogenic carcinoma, a type of lung cancer. This condition is usually suspected when a relentless cough is accompanied by unexplained weight loss, hemoptysis, and fevers with night sweats. It is especially common among those with a significant history of tobacco use or occupational exposures to harmful substances such as asbestos, radon, diesel exhaust, and metals. The complications of bronchogenic carcinoma can be severe and life-threatening, necessitating immediate medical intervention. Proceeding forward, chronic obstructive pulmonary disease or COPD is another grave condition. A ceaseless chronic cough with an excessive amount of phlegm increases the likelihood of COPD. This probability increases if there is a history of cigarette smoking. Moreover, the same cough, if joined with a history of recurrent or complicated pneumonia, could point towards bronchiectasis. Chest X-rays, CXR, prove to be a practical tool in diagnosing COPD accurately. COPD is a debilitating illness that progressively damages the lungs, resulting in gradually declining lung function over time. Another cause of cough is idiopathic pulmonary fibrosis. A chronic cough coupled with dry eyes could indicate Sjogren's syndrome and autoimmune disease. This condition impacts moisture-producing glands, leading to symptoms such as dry eyes and mouth, and in more serious cases affecting various organs. Moreover, a chronic dry cough might be the initial symptom of idiopathic pulmonary fibrosis, a type of lung disease that leads to the lung tissue becoming damaged and scarred. This condition is particularly concerning since the damage is often permanent and progressively worsens over time. These are serious health issues that warrant immediate medical attention. Don't disregard a continuous cough. It's more than just an annoyance. It could be a warning sign from your body that something isn't right. Remember, your health should always be your paramount concern. In light of the serious conditions we've just discussed, it's crucial to underscore the importance of seeking medical attention if you're experiencing a persistent cough. If your cough lasts more than a few weeks, or is accompanied by other worrying symptoms such as unexplained weight loss, night sweats, or blood in your sputum, please consult a healthcare professional immediately. Let's talk about prevention measures. While not all causes of persistent cough can be prevented, you can take steps to reduce your risk. If you smoke, quit. Not only will this reduce your risk of lung cancer and COPD, but it will also improve your overall health. Avoid exposure to lung irritants such as dust, fumes, and harmful gases. If you work in an environment where exposure is unavoidable, make sure you have the appropriate safety equipment. Remember, a healthy lifestyle can go a long way in preventing many health conditions. Regular exercise, a balanced diet, and adequate sleep can boost your immune system and overall health. Stay vigilant about your health. Early detection and treatment can significantly improve the prognosis for many of the conditions we've discussed today. In our next segment, we'll discuss some home remedies and over-the-counter treatments that can help alleviate cough symptoms. But remember, these are not substitutes for professional medical advice, especially if your cough is persistent or accompanied by other symptoms. Thank you for watching, and remember, your health is your wealth.